In northern Uganda, where rural communities depend on every drop of clean and safe water, the Sustainable Water Supply, Sanitation and Hygiene for All SWASH 4A project is changing lives. Launched in 2022 by SNV Uganda with funding from the Austrian Development Corporation, the initiative targets communities in Lira, Alebtong, Dokolo and Kole districts, aiming to ensure a safe, sustainable water supply for over 237,500 people and improve sanitation for 50,000. But the challenges are immense. In the rural and remote areas where SNV works, only 87% of people have access to adequate safe water supply, with borehole non-functionality at 15%.
Richion, nu tikere pi mara nu pe ber. Nu tuamu pi mara raj. Nu tuamu pi mara ti penkan luana mena bulu. Kere lela. Nu pe kele kushi kwa wakare shiel. Da nu wanye wa wangaro. Pi nu bor kedwa matek. Akadu worry. Duongi nu do tichituri kanu balle mara. Nu na haya duonga do pe yom. Na dega do ka wehekenu nu da wanko.
The well, the sanitation was not all that very good, and yet we are sharing with the animals also, even up to now.
Access to sanitation facilities is equally low, with just 16% of households having basic latrines and only 2% practicing hand washing with soap. These gaps leave communities vulnerable to disease, impacts of climate change, and economic hardship. To address these challenges, SWASH 4A works hand in hand with local governments to strengthen water, sanitation, and hygiene governance, ensuring that communities, civil society, and the private sector are all engaged in maintaining water systems and improving sanitation and hygiene.
I'm Ecolward James, the health assistant working with Alebtong District Local Government and attached to our sub-county. Majorly, I focus on sanitation promotion at community, basically looking at functionality of water sources and also at the same time improving on safe water chain. That is all connected to prevention of what? Sanitation-related diseases. We are not only focused on water, but we also go deep to the communities, improving on the requirements of an ideal homestead, majorly supporting communities in creating demand for improvement of sanitation in their respective households.
SNV focuses on post-construction support, ensuring reliable water services long after the infrastructure is built by empowering water user committees and sub-county water and sanitation boards, putting local leadership at the forefront of long-term technical and financial sustainability. Quality rehabilitation of point water sources and construction of durable latrines is essential to the project's success.
Ana chalo cha pachon me yupini bera be mira ra chiente atete reno kene gongol le visi gomola me ka pe homoro tie jon binu konyo wa yor me pini peri ka balle kede nenno kan pe home pini ti ye dwe mira ruong makanika me binu nenno pe homoro tie en chien na wan go kan ni beru kitu me nenno chulo ko ngato no ka binu yawo ye dwe mir nen ka pe homor ti ye au ka pe ha ti ate wan te dohi go mona me ro chiente me wan nu bien che jo te bi konyo wa ker ka na ti no chiente wan ni konyo me nenno ko yi bal pe ha ti yi pino gino ke na ti mer kan ti che no me nenno ke kanora me pe ha ti ye.
SWASH 4A skills masons and hand pump mechanics on the job and ensures compliance with national standards.
In a special note, we have empowered the capacity of the women, both women and men. So previously, we did not have female hand pump mechanics, for example. It was mainly the men who were doing this work, and yet the mandate when it comes to water, who suffers more? It's the ladies.
When there's no water at home, who will you ask that give me some water? It's woman. So we have certain female and mechanics in the association. We are all equal. We have certain men and certain female. So I'm happy. I'm not the way I was. If I go and repair the borehole, I get some money. I buy soap. I pay for my children's school fees.
Beyond infrastructure, the project drives behavior changes by using evidence-based hygiene promotion strategies to encourage households to build latrines and hand-washing facilities, increasing the adoption of hand-washing and sanitation practices.
We mobilized for the village meeting and we talked to the community. We triggered the community, like using the experiments. Basically, we are using sheet calculation. We triggered the community and they realized that they're eating their own feces. So they were like, if we are eating our own feces, this is a shame to us. And in this project, we look at the community having a toilet as a pride.
Na toilet wada lupa siara do kar ko siara do pasidong tia sila me udongo kai gina sial oyo bodo ko piendo fisia siak.
Drop by drop, life is transforming. Children now drink clean water, families are healthier, and the time saved translates into education, economic opportunities, and a brighter future where no one is left behind.